started having acne probably around junior year of high school. That's when I've seen the biggest change in my skin. And I think it's really impacted how I interact with some of my peers. Knowing that they have a lot of clearer skin has made me feel a bit uncomfortable at times. So I think that it's impacted my social life a little bit, and I've always wanted to, really try and get clearer skin. So, in terms of, meeting new people, it always goes by, first judgment. I tried clindamycin. That was first recommended to me by my primary care physician, and I tried the standard benzoyl peroxide from Walgreens or CVS. And I did notice some positive effects at first, but I found that my skin was getting resistant to the clindamycin, and that I had flaking and some negative reactions to the benzoyl peroxide and things like that.
I'm in 10th grade, and I started getting acne towards the end of 8th grade. I actually tried Proactive, but it never seemed to work with me because, I don't know, I didn't see any improvement.
I started having acne about my sophomore year in college. I tried every over-the-counter medicine you could. I tried Proactive. I was put on Accutane for a little while, and nothing seemed to work. Finally, my mom turned me on to Dr. Chillicurry, who started me with the treatments. And since then, I've seen actually significant difference, as you can tell.
I'm Sunil Chillicurry from Houston, Texas. I'm the founder and owner of Refresh Dermatology here in Houston. We've been fortunate to be using TheraClear for almost 5 years now. We see remarkable results with it for those patients who have acne. These are the acne patients who have tried a lot of other things. They haven't been quite as successful. They're not ready to get on Accutane, but they want something that's an answer. So we're able to provide that answer quite dramatically, quite rapidly with TheraClear.
I tried dermatologists in the past, through that my primary care provider had recommended, but they weren't really doing a great job. And I wanted somebody who kind of knew, was top of the line. I'd also seen Dr. Chillicurry interviewing for Fox News and ABC and things like that, so I was confident that he was a good guy. He introduced me to TheraClear. TheraClear itself was, it was kind of like a pinching feeling on my skin. And I gotten used to it, but at first it was just pretty new. But I did see a lot of, positive benefits from it.
I've had 4 treatments of TheraClear. Besides TheraClear, I use Retini and the Next Science. With TheraClear, I have seen quite a few improvements. My acne has flattened out, and the redness has also gone away.
I had about 6 TheraClear treatments. I believe I did them about once every 2 weeks or so. There was about 30 minutes of redness, but I was able to continue my daily activities after TheraClear. It really feels like it's a suction, so it's exactly what it feels like. Something's popping. There's a little bit of pain, but it's nothing ridiculous. It's very standable.
TheraClear works by addressing the one cause that we know is definite for acne. So we know with acne there's going to be a sebum overproduction. When you have overproduction, you have keratinization or lining of that follicular unit. With the TheraClear, what it does, it removes that sebum through a vacuum suction, and also it irradiates it using the IPL type technology, intense pulse light. With that, we're able to clear the sebum out. Along with that sebum being cleared, we find that the P. acnes is actually also removed, and we find that the acne tends to go away within 24 to 40 hours on many patients.
After the first one, I saw a lot of improvement on my forehead, and then after the second treatment, I saw improvement on my cheeks, especially. I had 4 treatments. I think each have been about 1 month apart.
The redness went away after a week. TheraClear treatment probably takes approximately about 10 or 20 minutes. After using TheraClear, you can go anywhere you would like because there's no effects afterwards. You'll come in and then you'll go out looking the same. So you could do it in the morning and then go to school and there will be no problem.
With TheraClear, the results were instant. All the pimples were gone instantly. You saw the progression get better, the redness slow down. About the first day or so, there was a little bit of redness, but it steadily went down with each treatment. So.
The difference between this IPL and traditional IPLs is the wavelengths that we're utilizing here. So these wavelengths are specific to targeting that sebum as well as the P. acnes, and what we're doing is when we're heating that up with this particular IPL, it's going to get rid of the portoporphyrins and it's going to help calm the skin down.
I would really recommend it, especially coming from somebody who's tried a variety of products. I know how hard it is to face I guess, the stigmatization that comes with having acne. And so I really recommend trying this new treatment.
I would recommend TheraClear to my friends because it has changed my acne a lot. And it's not as painful as other things.
I've actually already recommended TheraClear to my little cousin. He's going through the same problems as I was. He's doing the same thing, trying all the over-the-counter medicines, pretty much going down the same road. So if we can cut it short for him, then definitely would recommend it.
So this is an amazing device. It has suction that's based into it. So when you use that suction to remove the sebum that's inside that blocked follicular gland, it gives better access for the topical creams that we're using to get into place. We find that while we're using our retinoids, they're able to penetrate faster, more effectively, and we see the acne clearing away much, much faster than any other device that we've ever used.